And good morning, PSWs and friends across Ontario and Canada. Welcome to PSW Podcast, where we come live every single Friday at 11 a.m., where we talk about the PSW world, what's new, what's happening, the black, the gray, definitely the gray area, and of course, all the good that PSWs do for everyone across our nation. My name is Miranda Romanowicz. I'm the CEO of the Ontario PSW Association and host of PSW Podcast. And I'm actually really thrilled today that I am joined by Danielle Mann, who is a personal support worker. She is the lead PSW and the general manager of Open Minds Cambridge, which is a new PSW-led center in Cambridge, Ontario. Danielle, welcome to PSW Podcast, and please tell us a bit about yourself and about Open Minds Cambridge.
Thank you so much, Miranda. I am Danielle. I've been a PSW for about 13 years. I have worked all over the place, from newborn right up to end-of-life care. Open Minds is a day programming center for individuals who are on the autism spectrum, who may have developmental disabilities or mental health support needs. We have decided to expand and open our doors for day programming to the geriatric sector. So as all PSWs know, we are able to help with range of motion exercises and all areas of care. So we have decided to turn our center into an entire PSW field day, I guess we could call it. And it's really just to show what PSWs truly can do and how much and how far we can actually reach. There's not much that a PSW is unable to do. And I don't think a lot of people actually realize that.
No. And that was one of the whole reasons for us bringing you on the PSW podcast is you are not the first PSW-led center in Ontario. There is another one up in Meaford called Journey Center Grey, which is proudly run by Natasha Bell, who is an OPSWA PSW like yourself. And, it is interesting because, being on this journey, and just for transparency reasons, I am owner of Open Minds Cambridge. So that is why we're doing this, is because we saw a need in our communities. We see a need for PSWs to, help whomever we can help. And like you said, Danielle, it's so absolutely, it's confusing to me how people really just put the PSW in the geriatric sector. That's all we do. All we do is work in long-term care and home care. And that is not the truth. PSWs can work anywhere. And I wanted to showcase this to PSWs because I've talked a lot in the past podcasts about PSWs can expand your horizons. You don't just have to work in these sectors. You can work anywhere as a personal support worker because PSWs literally care for individuals from 0 all the way up to 150, because what we do for individuals is activities of daily living, which is what everybody does. You know what I mean? So so tell me about what a day in the center would look like.
Every day is going to look a little bit different. I do like to cater towards each individual themselves, but a day would literally just look like learning different life skills, socialization skills. We will be doing little trips and community outings. I'm hoping to partner with different long-term care facilities to look into pen pals, because I think that is a huge strength and people don't realize what writing a letter can actually do for not only the individuals we cater to here, but also the individuals in a long-term care facility. Having that companionship and that comfort and learning how to socialize on a letter and write is a huge life skill that a lot of individuals lack. So we are going to learn everything from how to tie a shoelace to how to cook a meal. I would eventually like to expand out and do volunteer job opportunities as well and have individuals learn how to get job ready, when it can be building resumes and finding different volunteer placements to expand their range of what they've done and all the experience they have to place on a resume.
Yeah, which I think is fantastic because there's not a lot of that. I mean, there are some centers, obviously across our region here in KW, but also, in other regions, but they're not PSW led, number one. Number two, we're not even sure if the people working there actually have any formal training in order to work with these individuals. And so that's what I think why PSW is so important in these centers because we have so much to offer the individuals that are going to be coming into these centers and that require that extra help in order to get themselves, I like to say, adult ready, shall I
Yep.
say,
Yep.
or even just to have that social social atmosphere, that companionship, being in a safe space that they're able to express themselves how they need to, and that they know they can be themselves within this environment. So I think that is really, really important. And I mean, so the center also offers one-on-one, right,
Yes,
Danielle?
absolutely. And like you said, there's so many centers, but with us being completely PSW led, we have the ability to do so many things. And I'd love to be able to sit and expand on what so many things is, but we don't have all day. So um, we can offer one-on-one care because PSWs are trained to take care of individuals. And you had said earlier, so I'm going to double back on the statement about PSWs being able to work from 0 to 100. Um, Specialization is so important because realistically, like you said, we can work anywhere. So you can specialize in pediatric care, you can specialize in end of life care, you can specialize in mental health, in autism care. There's so much a PSW can do. It's just continuing your education. And I think a lot of people think once they've taken that PSW course, that's the end of it. And it's not.
No, it doesn't have to be. I mean, some people choose that and that's in
Yeah.
their right and that's great. But when I think a lot of PSWs are under the impression that their only bridging opportunity to expand or specialize is into nursing. And now I'm not saying that's a bad thing. If you want to be a nurse, go be a nurse. I think the best nurses start as PSWs in all honesty.
Absolutely.
But, like you're saying, there's so many opportunities. And that's what we're trying to do here at OPSWA is, it's not all just you're not in a box. You know
Yes.
what I mean? Like PSWs have so much room to expand their horizons. And one of those areas as well is our private practice PSWs. So these are PSWs that are entrepreneurial. They are private working PSWs. They work for themselves or they formed private home care companies that they, employ other entrepreneurial PSWs and they all work together to serve their communities. And we're actually through Open Minds and OPSWA in the coming weeks, we're actually going to be having a platform on our website that is going to allow families and loved ones or individuals who require that one-on-one support to access these entrepreneurial private practice PSWs so that they can, and they are affordable. That's the one thing that drives me nuts. And when we talk about Open Minds, Danielle, and we talk about even Journey Center of Gray up in Meaford, is the reaction that we get from the public is like bizarre, really
It is.
truthfully. Yeah. Yeah.
It
Like what have
really
you
is.
got?
Pardon?
What have you gotten? Like what sort of reactions have you gotten from the open houses and stuff?
I have had so many people just amazed that PSWs can do this. And it's opened up a lot of conversations. And I've had some different companies come in and they are truly amazed as well and absolutely in love with the idea. And they
Yeah.
were so happy to see that PSWs are actually taking another route.
Well, we need to. I mean, one of the major reasons that I mean, even OPSWA paid attention to this so closely is, I mean, this center has been a journey of mine and my husband's and my daughter's for a long time because of our son who's 22 and has autism. And we realized when he turned 18 years old, there was literally no supports for him in the community that he could go out and be amongst his peers and obtain life skills and so on and so forth. And then through OPSWA, of course, with Ian De Silva, who's our chief operating officer, we started realizing like there's no supports even for the youth, the young, autistic individuals, mental health, because especially through the funding, the autism funding, they're 5 years behind on the
Mhm.
autism funding here in Ontario, and families are not getting that respite. They're not getting that option for private pay, which, by the way, we don't charge a whole ton at all. It's very affordable. But also with PSWs being that private practice area, they PSWs are extremely affordable for families for respite care, and people don't understand that. And like I have a respite care PSW that works directly with my son, and it's affordable, and and it works. But people just, I don't know why. It's like, stop thinking and sticking yourself inside the box. Like, you guys got to come out and be who you want to be, work where you want to work. Because
I
as a
think
PSW,
people,
like you said, we're also malleable. We can do whatever we want to do.
yeah, people look at things so black and white, and they're not looking at that gray area.
No.
I think finding that gray area and shedding so much light on it, like OPSWA does, I think that's really going to help our PSWs and the community realize what we can actually do.
I think PSWs live in the gray area.
Oh yeah.
Let's be honest. We kind of do, because it's like, a PSW can help, like we have perinatal support workers. They are PSWs. They have to be PSWs first before they do that training to become perinatal support workers. And it's
Yep.
not very well known, but it's becoming well known. They work with pregnant mothers, and they work with newborns, and they go through the whole birthing process with the with the parent. And they go like, and then we have people that are, hospice care, hospice and palliative care. We have mental health. We have autism. We have foot care. You know what I mean? Like, the sky's the limit as PSWs. And, the PSWs need to realize that, because we get a lot of, oh, I need a job. I need long-term care. I need long-term care. I need long-term care. I
Yep.
need long-term care. I mean, I could go on and on, long-term care.
Yep.
And, but the thing is that there's not a lot of work in long-term care. I don't care what the Minister of Long-Term Care says. There is not.
No.
Okay. Number one. Number two, that's not the be all end all. I have PSWs that are working in hospitals that are on the sunshine list, for shit's sake. Like, these people are making really good money doing something that they love. And we have that ability, because we're not massively regulated like the nurses and the doctors. We can kind of branch out to all different areas and do kind of what we want to do. I mean,
Yep.
we are being regulated, but it's not going to be the same as the nurses and the doctors. So we're able to kind of expand on all of this stuff. Um, we have a question. How to get all those specializations as a PSW? Okay, that's a really great question, and thank you very much for asking that. So, how you become specialized? Well, there's a lot of different options. So, I myself I'm a 2006 grad of the PSW program, Mohawk. I'm just doing a bit of a shout out to Mohawk grads here. But so when I graduated as a PSW, I really wanted to go into mental health. That was my area. That was my vibe, my jam. And so I started looking for micro credentialing, workshops, seminars, anything that I could add to my resume, my portfolio as a personal support worker. And it's a lot easier to find that stuff now, because at the association, we actually do a mental health course for PSWs, and we are looking at a specialization in mental health for PSWs as well, because we already have one for autism. So now we're looking at mental health. But you can look at CAMH in Toronto. You can look at McMaster University. They have some great micro credentialing. Anywhere that you can try to garnish and grab that information, that's how you specialize. You just got to find it. That's the only thing. And we invite you to reach out to the association if you can't find anything. We do have a lot of partners that do give that education for personal support workers. So best of luck. I hope you find something. But what did you, so Danielle, I mean, you talked about where you worked. I know you worked in long-term care, but you also worked in group homes.
I have. I worked at a group home. It was a live-in group home for adult males who were on the autism spectrum, and they lived there 365 days a year.
And what was that experience like? I mean, to go from working in long-term care to working in a group home must have been a kind of a big kind of change.
It is. It's a huge change, but I actually loved it. To me, it wasn't like waking up and going into work. I was just going to my second home. So our jobs were everybody's job in one. So when you go into your job in long-term care, you're battling nurses who look down on PSWs. You're going into the dining room and battling dietary aides because they want to argue with you over the resident's diet or consistency. But working in that group home, it was very much, well, everything's on us. So we had to be med trained. We had to do all the cooking, all the cleaning, um, all the PSW jobs like showering, dressing, activities of daily living. So it was very different, but I don't want to say it's better or more relaxed, but it is definitely more relaxed with more responsibility. Um, but working with those individuals, I did find it a lot more rewarding.
Yeah,
Yeah.
sorry. Hold on a second. Um, I like that you said all of that because that is a massive difference between, and anywhere a PSW works is different because you're also going to deal with different dynamics within, like you said, the nurses and the dietary aides and all this different sort of stuff. And we really have our roles, very
Mhm.
defined roles, especially in long-term care. But when you get more out into the community, the roles become a bit more skewed and the PSWs become a bit more responsible for different things because we are the ones that are trained more. I don't want to
Yeah.
say better, but more on
Mhm.
certain things, especially activities of daily living. I mean, one thing that personal support workers own straight out is ADLs and is personal care. PSWs own it. That's what we do. Nobody else does it. We do it. And so that's what makes us a different profession to that of the nurses or the doctors. We're not nurses. We're not caregivers. We're right in between. That's where we are. We're right in between. So it's
Yeah.
important to define that. But someone had asked, what's the most lucrative kind of specialty for PSW? And I just want to address that. There is no one more lucrative than the other. So it depends on whatever the heck you want to get into and how much work you put into it. At the end of the day, it's all about being innovative, all about thinking outside the box and thinking about how to create your own career. I mean, if you look at Danielle's running an entire center for that's PSW led for, adults and kids and teenagers. It's all over the place. But she's a PSW and she's using her expertise in order to, execute everything that happens in this center. So you got to look at your strengths and you got to look at um what you want to specialize in. That's what that is. So, there's no more lucrative than the other. I will say though that when I worked as a mental health PSW, I was making really good money back in the day because there's not a lot of us. There's not enough.
No.
Um, what am I passionate about? Is that a question?
No, do what you're passionate.
Oh yeah, do what you're passionate about. Yeah, sorry. There's another thing, but do what you're passionate about. Don't just do something because it's going to make you more money. That's not what a PSW is about. That's not the soul of the personal support worker. You have to do what you love to do. So don't go into like diet or not dietary, but like oh my gosh, diabetes care, caring for people with diabetes and specializing in that. If that's not something that you really care about just because you're going to make $5 more an hour at that place and you would, doing foot care or mental health. You have to do what you're passionate about because if you're not passionate about it, it shows. Trust me, it shows.
And that's
We
what I was
see
going to
it.
say when that question was asked. Like PSWs or anybody in healthcare goes into the healthcare field because that's something that they are passionate about.
Mhm.
So when you dive into that field, even in school, I wouldn't say taught on everything that you're able to do, but you are introduced to the different things you can do. And so something obviously has to resonate with you while you're learning about the different areas. So grasp onto what is resonating with you, specialize and take flight. Do what you love.
I think that sky's the limit for PSWs, especially the private practice PSWs. I mean, we're going to be announcing some really cool stuff in the coming weeks for our OPSWA private practice PSWs. Um, because there's just such a need. And unfortunately, home care companies are great. A lot of them are, really decent, but they cost too much money. And there's no continuity of care. The continuity is not there. And a lot of families are looking for that continuity, and a lot of them are looking for control over their care, which they by rights should have. So yeah. Anyways, Anyways, so I just wanted, so for anyone for information on Open Minds Cambridge, if you guys are interested in it, if you know of clients that would benefit from it, if you have loved ones that would benefit from it, you can find out all information at openmindscambridge.com. We'll put some advertisements up on our pages on TikTok and on Facebook so that you guys can see it and you
Let
guys
me
can.
also add that there is a lot more coming to Open Minds Cambridge. As of this morning, I have decided to expand on what we will be doing here. So even if you have any questions, send an email. We can probably do it.
There you go. Perfect. I love it. So Open Minds Cambridge, PSW Lead Center in Cambridge, Ontario, the second of its kind. You can also visit Journey Center of Grey, which is in Meaford, Ontario, which is also a PSW led. And I'm proud to say they're both OPSWA PSW led centers here in Ontario, with more to come, I am sure. Thank you very much, Danielle, for joining us on Open Minds Cambridge on PSW podcast. It's a Friday.
Thank you.
Excuse me. I appreciate everyone who always comes out and listens to us and gets information from us on all things PSW. We will be back again next week where I'm interviewing Dr. Williams from Apollo Cannabis. So I hope that you guys join us then as well. Very interesting conversation to come then. If you want information on Open Minds Cambridge, it's openmindscambridge.com, or find more information on both of our platforms on TikTok or on Facebook. Thanks very much for joining me, Danielle. Remember, if you're not a member yet, hop on it. All information is in the link in our bio, either on TikTok or here on Facebook. And with that, I'm going to say, have a great weekend. OPSWA out.